NIH is supporting 65 new implementation research projects across the country in support of the new Ending the HIV Epidemic, A Plan for America. I'm Anne Rancourt, and I'm joined today by Dr. Carl Dieffenbach, Director of the Division of AIDS at the National Institute of Allergy and Infectious Diseases. Carl, thanks for joining me.
My pleasure.
So we're going to talk a little bit about implementation research today and what's going on, and we would love to take your questions and comments during the broadcast, so please enter those in the comments field as we discuss. So Carl, to start us off, what is implementation research?
Implementation research is the process with which we define how best to deliver care and treatment and testing and the other activities that are essential for helping us address the AIDS epidemic. It is really that simple. But it is, if you think about it, that's very easy to say, but it's very complicated because every situation is different because we're dealing with such a difference in terms of the local environments in which we need to provide prevention, care, treatment, and testing.
And so let's take PrEP as an example, HIV prevention. We know that PrEP is 99% effective if taken as directed in preventing HIV, but it's not so simple as just that because people need to find out about PrEP and know what PrEP is to begin with. And that's where implementation research can come in.
Yeah, I mean, from the very beginning, is an individual who may benefit from PrEP first and foremost aware of PrEP? How do they become aware that pre-exposure prophylaxis even exists? If they decide that it is something they may want to pursue, how do they find a care center? What do they do? How do they go about this? And once they make that decision, what's the interaction like between the healthcare provider and the system and the individual? How do they pay for PrEP? Is a big deal. And then ultimately, once they decide, how do we as society assist that individual in staying on PrEP? Because PrEP doesn't work if the pills sit in a bottle. Now, this is all part of what implementation science is. It's about successful delivery of prevention and care to the people in need.
And so the Ending the HIV Epidemic, A Plan for America, is taking place in certain targeted jurisdictions around the country that are particularly affected by HIV. 48 counties, San Juan, Puerto Rico, Washington, D.C., and 7 rural states. How will this implementation research be taking place in those areas in particular?
Yeah, let's just take a step back, because ultimately HIV is a national problem. So one of the beauties of what the Ending the HIV epidemic strategy has been is we're going to focus first in these hot spot jurisdictions and then over the next couple of years expand out to cover the rest of the country. We are not solely going to be working in those jurisdictions. But to begin with, we thought we would jumpstart a series of implementation projects within those jurisdictions. And the way we went about that is NIH funds a series of centers programs that have the long arms to reach into communities, to talk to researchers in community, to talk to community advocates, community members, as well as work with local community-based organizations to design a project that will address one aspect of ending the epidemic, one or more aspects of ending the epidemic in those jurisdictions. And just to be clear, the areas are how to test, how to prevent, how to get people into treatment, and how to respond to emerging outbreaks. But ultimately, the decisions were between the researchers at the centers plus the community-based organizations and community in these local jurisdictions. The goal is to work within the community for each of these projects.
And so I gather community will be central to this effort.
Well, community has been central in these types of interactions. We've been working in this way since about 2012, engaging in ways to bring the best implementation science into communities. And so what this does is it refocuses and re-energizes our efforts because we have a really significant goal and a commitment, at least from this administration, to take this forward.
And so looking at some of the research that will be taking place, it looks like there are projects specific to certain cities, New Orleans, Philadelphia. Is this really geographically targeted as well?
So I think we have to think about, in politics, all problems are local. And so if you think about HIV epidemic, it is within the local jurisdictions where these problems need to be solved. people live in cities, they live in rural counties, but ultimately how they access their care needs to be in that environment. So we have to ask these implementation questions where the people who need these services live. So in that sense, these are very hyper-local activities. So if you think about ending this plan, it is a national plan. It involves big parts of the federal government, a big umbrella, as it were. But the umbrella has to be nimble enough to provide the ability to work at the hyper-local or very local jurisdictions so people can access their services. So that's where we need to solve the problems. So implementation science needs to be at the local level and can address one or more of these kinds of challenges.
And so, Carl, NIAID recently announced $11 million in supplemental funding to these Centers for AIDS Research and AIDS Research Centers to do this type of work. Tell us a little bit about what that funding investment will do.
So that funding investment will work in the vast majority of these jurisdictions. We're making 65 awards to cover those 4 areas across the country, in San Juan, in Washington, D.C., in the majority of the counties, and most of the states. That's a good start. And so as such, we're pretty pleased with what we have. We took some funding from the Office of AIDS Research here at NIH and from the Secretary's office. So we were able to build this into a coherent package of activities that will ask and address some very fundamental questions in these jurisdictions over the next year.
And can you give us an example of a question that might be asked?
Sure. Take something as simple as, where would I get my pills if I decided I wanted to take PrEP? So think about it a minute. It may seem like a silly question, but it's really not. Does an individual want to go to a pharmacy and pick up their pills in person? Or would they feel better getting their pills delivered directly to their house of residence, their residence? Or would they rather go to some sort of Dropbox situation where they got a code and were able to go pick up their pills in a covert way? I think that this is the kinds of questions and options people need in order to make it easier to access PrEP and therapy.
Wonderful. And so even though these studies will be done in a hyper-local sense, will the findings be able to be extrapolated to other communities? Can they take away something from this research?
Well, there's 2 parts to that. Is how do you first get all the information in? So we funded a coordinating center out of Northwestern University to help bring all the data together from these. And ultimately, we will generate information and make this available through publications, through our standard ways, and through other meetings, so that other jurisdictions can see the findings that emerge. But ultimately, each jurisdiction will have to take the finding from another place and decide if it's generalizable to meet their needs. So the steps would be proof in an individual area, but then the generalizability. But we have a 10-year goal here. So first we have to prove it works locally. Then how can we support the next steps of the generalizability, and then ultimately get it into more of a practice situation where people like CDC and HRSA would be implementing this within their community-based organizations as they move forward. This is ultimately a partnership at multiple levels between federal partners as well as working at the state, local, and city level.
And so 10 years might sound like a long time, but in the research world, that's typically not that long. I mean, you're often doing large multi-year, multinational studies to find out if a drug works and is safe and effective to prevent HIV, things like that. These are relatively quick and nimble projects, right?
They're short. And I think that's part of the challenge, is that many of these may be a little too short, and we'll have to look at which ones will need to be extended for an additional year based on success. So I think we have some flexibility here. But ultimately, the idea is to get answers quickly in a way that then we can move to the generalizability part of this equation so that we can really start to have an impact. If you think about it, in the United States, we have had a stable epidemic of about 38,000 infections for a number of years. The definition of insanity is to continue to do what we have always done. This is an opportunity for us to grow, change, and innovate, and do things differently and better so we can truly impact the epidemic in the United States. And I think this is a really good start, but it is just a start, and we have so much more we need to do.
And in terms of what else can be done for folks who are watching in communities around the country, folks who might already be involved in HIV advocacy and work, what can community partners do to help?
Well, it's essential. First of all, we cannot address the epidemic without community and without community partners. So if you are involved, great. Continue doing what you're doing. Get engaged with your local organizations. If you're not involved, figure out what organization you would like to work through. Is it your church? Is there a local group that could be organized to do more for the HIV epidemic? Just take testing, for example. Suppose your church had a testing on a given, your church or synagogue had a testing on a given Saturday or Sunday. It would be something that could be done, and it could then be linked to clinics where people could then access health care. But it's about what you can do at the individual level as an individual plus a community organization to help solve the problem.
Wonderful. Carl, thank you for joining me today. And thank you for watching. You can find more information online at hiv.gov.